When it comes to heart health, it's sometimes difficult to separate myth versus fact. Dr. Babar Parvez, an electrophysiologist with ThedaCare, is joining us to set the record straight. Thank you for being with us.
My pleasure.
Okay, so we're going to take a look at some of these statements, see if they're myth versus fact, and then we're hoping you can explain them for us.
Of course.
Okay, our very first one here is heart disease can affect people of any age.
That is actually a fact. As we know, there are little kids which are born with heart disease, so it can start, as a matter of fact, right from even before birth. Congenital abnormalities, both of valve dysfunction, blood vessels which are not in their correct position. The chambers of the heart are not properly formed. Young people can have heart rate and blood pressure issues. And as we grow older, then we start having heart blockages and all sorts of other heart diseases.
Okay, so any age. All right, wearables such as smartwatches, things like that, they can detect problems with your heart.
That is an absolute fact. Nowadays, wearables of different manufacturers can detect irregular heart rhythms, fast heart rate, slow heart rate. They can even detect your blood pressure, your sleep pattern, your oxygen levels, also how much you are moving, all of which are linked with heart disease.
Oh, okay, good to know. All right, next one here. Women are more likely than men to have heart disease.
That is a myth. In men, heart disease starts earlier.
Okay.
Women have a buffer because of estrogen.
Right.
So women catch up after menopause. But men, unfortunately, have heart disease earlier, not only because of lack of that protective hormone, but also because of our inherent nature to be more prevalent to hypertension, stress. Men are also more likely to go to extremes on certain activities which are not very healthy, like smoking, alcohol intake, just sedentary lifestyle. So all of those things start compounding.
Good to know. All right, our next one here. U.S. cases of atrial fibrillation are projected to double to over 12 million by 2030.
That is correct, and it is a fact, and some of us project even more. AFib, unfortunately, it is predominantly an incurable condition. So the newer cases are becoming more and more because of prevalence of heart disease, the overall aging population. People are living longer because of advancements in medicine. And that is why, yes, cases of atrial fibrillation, heart disease in general, hypertension, diabetes, all of those are on the increase.
Okay. All right, Dr. Parvez, thanks so much for being with us and providing insight into all of these things.
Thank you, my pleasure.